Hospitals around the country are continuing to face pressure as the spread of Omicron puts more stress on the healthcare system. Alongside hospitalized COVID patients, our next guest says that his main concern right now is staffing. Joining us right now for more is Dr. Sharif El-Nahal. He is the CEO of University Hospital in Newark, New Jersey, where over 300 employees are out of work right now because of COVID. Doctor, thank you very much for being here. Why don't we talk very specifically about staffing and other big concerns you're facing at the hospital right now? Where do things stand?
Yeah, thank you so much for having me. So we have about half of our beds now filled with patients who have a diagnosis of COVID-19, but over 60% of them actually came in with COVID-19, but not for COVID-19, based on whether that's the primary diagnosis or not. And so I think that's important to understand, because ultimately, in the context of the staffing crisis we're facing right now, I'm actually more worried about a healthcare problem rather than a COVID-19 problem. Right now, we're seeing our workforce demoralized. There isn't a light at the end of the tunnel that I can paint now as I did in the spring of 2020. And we're seeing a flight from healthcare for very talented clinicians between the ages of 45 and 60, often the most energetic and knowledgeable folks in the hospital. And I think that's going to be a problem that may actually outlast the Omicron wave, which seems to have already plateaued, at least in cases, in the New York metro area. And so I'm hoping that there's going to be some national policy solutions to this, because we have a lot of public health problems to contend with in our community after this Omicron wave.
What public policy could be put in place that would make people feel better after living through almost 2 years of this constant strain and extreme pressure that the frontline hospital workers have been under?
We need a lot more focus, I think, on healthcare workforce development, making the incentives even better for folks to enter the workforce mid-career in addition to the beginning of their careers. As I said, the folks that are between the ages of 45 and 60 are fleeing healthcare right now, which is really impacting us. So anything in the form of incentives for loan reimbursement, loan payment, but also investment in the public health problems that we're going to be facing next. Right now, we're planning hopefully to build a women and children's focused hospital on this campus. We're going to be announcing soon a master plan to do that. But without the essential workforce that's needed to complete that task for the community, we're going to be facing a lot of problems. And so I think it's important also for a clear definition from the government on what the end game is here. What is the light at the end of the tunnel that I can paint for my staff to say that we're moving to the endemic phase? I think the CDC is doing their best, of course, to adapt to rapid evidence, but some definitions, some targets on a realistic level of cases, knowing that Omicron is spreading uncontrollably right now, that even vaccinated folks are getting it. All of that needs to be taken into context for us to, again, paint that picture for what the next step is when we're finally going to evolve from this stage.
Doctor, you mentioned that the CDC is kind of moving us towards that endemic phase of all of it, but you said that there have been problems with it. Obviously, it's created a lot of confusion. What would you like to hear more of from the CDC?
Well, I think, first of all, having been a public health official myself, it's never easy to adapt to rapidly evolving evidence, especially in the context of a global pandemic. So I'll say that up front. But again, some degree of targets, benchmarks for when we are moving to the next phase here, when we can stop viewing this as something that should be, shutting down businesses, debilitating, normal life per se. Just as an example, flu every year does send vulnerable people to the hospital, unfortunately, and many of them do pass away. But we don't have nearly the level of disruption to operations that we see with Omicron. And Omicron, I do think, is a little more severe, at least, than the flu at this point, based on the data we're seeing. But at some point, we need some guidance on the next step. What case level will define the endemic phase? What does that mean for rules on the healthcare system and what we can do and what we should avoid? How much capacity should we be creating? What is the guidance for healthcare institutions that are going to be dealing with this pandemic, but also the aftermath with mental and behavioral health issues exploding in the community, the aftermath of deferred and delayed care, the staffing effects on safety and quality of care right now in our hospital and for our beds? I think some picture painted for what to expect and when we hope to expect it to happen is going to be really important.